I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
If you've listened to the news, and there's a lot of news going on lately, it's almost news overload, you'll notice that there's a new strain of COVID that's out there. It started in England from what we think, and then we found it in a couple other places. Now we think it's here in the United States. And there's two problems. Well, one problem is that supposedly it's more contagious. Now, we're really not sure because it's only been found a couple of weeks ago, if that. Supposedly, it's no more infectious. It's just more contagious. So what does that mean? Well, we don't know. Now, a lot of people are coming to me and saying, Dr. Joe, there's a problem. There are no cases of flu, no people getting a cold anymore. Everybody's getting COVID. Why is nobody getting colds and flu anymore? So I had to dig into this because I wasn't sure myself. And what I think is happening is we're doing all the things we're supposed to do to stay clean. You know, we're social distancing, washing our hands. People are more aware of their immune system. We're seeing a huge increase in people showing interest in their health, which makes me very excited. We're seeing a lot of people getting supplements coming in for care in our offices, people sending me questions about their health. So I'm really excited about that. If there's such a thing as a silver lining in this whole COVID mess, is that people are finally taking responsibility. The explanation I've heard is that we have less cold and flu because cold and flu is less contagious than COVID. So even though we're doing all these things to protect ourselves, COVID is still getting through and getting into our bodies. Cold and flu, not so much, because social distancing, washing our hands, masks are supposed to help that. So that's the explanation, that's the official explanation that the CDC is putting out. I hope it's right. I don't know if it's right or not, actually. I don't know if it's hope. If I say hope it's right, I don't know if it's right or not. It's logical, but why is COVID so contagious, I guess, is the big question then. So that leads us to the show topic today. Why are certain things so contagious and they affect some people more than others? And that's a question I get too. Well, Dr. Joe, I work and 5 people I work with had COVID and I didn't get anything. And one of the guys I work with at the radio station, as a matter of fact, thinks he had it. He hasn't been tested for anybody. It's a long time ago. Because he was surrounded by people with it. He got a little scratchy throat, lost his sense of smell for half a day, and then it was gone. So why is it affecting some people more than others? Well, some people just have genetically better immune systems. Some people are just better at it. Like I haven't got the flu in, I don't know, I was probably 7 years old. I remember being a kid and having the flu. Haven't gotten it since then. Well, I take care of myself. I eat right. I take supplements. So I also may have a good genetic predisposition. My mother's got amazing genetics. So there could be a genetic predisposition. It could be other things, though, too. So if you don't have the blessing of good genetics, and maybe you do, you don't even know if you do or not, because this is something new, there are other things that are happening. And one of the big things, it's a compelling report, it's a Journal of Gastroenterology, and it's a radical novel idea, but I liked it because it was radical. Logically sound explanation as to why some COVID patients develop life-threatening organ failure and some COVID patients don't. So whether you get it or not is one thing, but whether you die from it or not is the big question. And the data indicates that COVID-19 mortality rates are heavily influenced by the amount of unsaturated fat you eat. Now, you've heard the saturated fat, and it's the way the chemical bonds are. It's saturated with hydrogen or unsaturated. It's polyunsaturated. But the less hydrogen bonding there is, the less saturation of hydrogen there is, makes it a unsaturated fat. Now, if you know what unsaturated fats are, those are vegetable fats. And we've heard that vegetable fats are good. Now, wait a minute. This new study out saying unsaturated fats are bad. Confused? Nope. I get confused too. Believe me. It takes me a lot of research to iron this stuff out for you guys. So simply put, certain unsaturated fat intake is associated with increased mortality from infection. So it doesn't really say if you're going to get more likely to get the infection or not. It's saying if you're going to die from the infection or not. Now, there are no clinical studies done on this yet, but it's probably time we do one. Because I like this philosophy, I like this concept where it's going, because it fits into everything I've been teaching you guys for the past 40 years. There is research showing that the primary disease maker in the Western diet, what we eat as Americans, is something called omega-6 fatty acids. Now, if you've listened to my shows before, I talk a lot about fats, and there's omega-3 fatty acids, which are really good, and they help the brain function, they help the immune system, they help with inflammation. I take an omega-3 supplement every single day. I take Dr. Joe's vegan omega-3. It comes from algae. It's the purest form on the market as far as I know, and it's the one I take. It's one I recommend you take too. It's on our website, drjoe.com. So you just go to the website and you can get it there. Omega-6 fatty acids are inflammatory. Now, you need a little bit of omega-6 fatty acids. You only need a little bit of omega-3s as well. But you need a little bit, but not too much. The problem is when you get too much in it. And diet-related comorbidities, make sure you understand this sentence. Diet-related comorbidities are responsible for 94% of all COVID-19 related deaths. Diet-related comorbidities, the things that you're doing, that food that you're putting in your body is responsible for 94% of the COVID-related deaths. Now, if I had a pill that I can give you, they're trying to come out with pills, or vaccines anyway, and they say, okay, if you take this, we're going to reduce your risk of dying by 94%. You think everybody jump on board? Well, that's what they're exactly saying. 95% is their success rate now, or a little higher with the vaccine, supposedly. So we have something that's as effective as supposedly a vaccine is going to be, absolutely free, no side effects. It's your diet. So why isn't everybody going nuts on this? Well, I am, of course. 94% of all COVID-related deaths are diet-related comorbidities. So what you're putting in your body is going to determine how bad this thing gets for you. Taking control of your diet is simple, common sense strategy to lower your risks of all disease and lower your risk of all comorbidities. Now, if you don't know what a comorbidity is, I guess I should back up a little bit. If I have diabetes, that's my primary issue. If I'm overweight, that's a comorbidity. Another thing that I have wrong that's going to make the first problem worse. If I have heart disease, if I have diabetes, if I'm overweight, if I have allergic reactions, if I have colitis, Crohn's disease, autoimmune diseases, each one of those is a comorbidity to the other one. So 94% of deaths are related to food, diet-related comorbidities, which means you have the answer to solving this problem. You do. I don't. You do. What you put in your body is going to have a direct correlation. Now, linoleic acid, omega-6 fatty acids, makes up the bulk, about 90% of the omega-6 fatty acids consumed, and is a primary contributor to nearly all chronic diseases. So 90% of all the omega-6 fatty acids, there's different types of omega-6s. 90% of the intake is from linoleic acid. It's an essential fat. When consumed in excess, it becomes metabolic poison. So the reason for this is because polyunsaturated fats like linoleic acid are highly susceptible to what's called oxidation. And so oxidation means they break down. I'll try to keep it simple for you. And it breaks down into different things like advanced lipid oxidation end products and oxidized linoleic acid metabolites. Don't worry about the chemistry here. One of those breakdowns, one of these what's called a metabolite is called ALE. And this is known to cause DNA damage. Now, DNA is the part of your cell that replicates. It's the reason you're you, and it can damage DNA. Studies show that there's a definite correlation between elevated levels of this 4-HNE and heart failure. So unsaturated fats oxidize, they go bad. When they go bad, they produce these metabolites or these byproducts, and these byproducts are highly toxic to the body. It's really what it boils down to. Now, you've heard me talk a lot about excess sugar. This is bad for you. I recommend you don't do any more than 25 grams of excess sugar a day. 25 grams is not a lot. It's only like 2 or 3 pieces of fruit. So you don't want to put a whole lot of sugar into your body. But even with all the sugar we're eating, it doesn't cause a fraction of the oxidative damage that linoleic acid does. And again, 90% of your unsaturated fats, your omega-6 fatty acids, are linoleic acid. Wow. Isn't that crazy? So processed vegetable oils are the primary source. And where do we get vegetable oils from? Well, how many people use peanut oil? That's a omega-6 fatty acid. Very cheap. Mixed vegetable oil, corn oil, soy oil, loaded with omega-6 fatty acids. And that increases the risk of oxidation. And the oxidation causes metabolites. Metabolites can cause disease and damage to your DNA. And you're doing this stuff every single day.
Aren't all the healthy potato chips made with peanut oil?
Yeah, the healthy potato chips. I know, right? Yeah, Garrett's a wise guy over there. The healthy potato chips, the healthy foods made with peanut oil, loaded with omega-6 fatty acids, and they oxidize. One of the worst things you could put in your body is bad oil. So let's assume you like peanuts. You shouldn't eat peanuts, by the way, for many reasons. But let's assume you like peanuts, walnuts, cashews, pistachios, peanut butter, and you taste it, and it tastes bad. We've done that before, right? You've had bad peanuts, oil, whatever it is, and it doesn't taste right. Throw it away. It's oxidized. It's one of the most dangerous things you could put in your body. And yet everybody's talking about sugar and cigarette smoke and artificial sweeteners and meats and dairy products. All that's bad, but this is also bad, and nobody seems to worry about that. How many of you right now, if I went into your pantry, how many of you have bottles of corn oil or soybean oil or vegetable oil sitting in there for years, decades? I bet you do. Garrett's nodding his head yes. I bet you do. And so what's happening is these bad oils are oxidized and they're weakening the immune system, and that causes problems. Now, I've talked in the past about omega-3, omega-6 ratios. Now, you should have about one omega-3 molecule to one omega-6 molecule in your diet. Very few people have that. You can go as high as one omega-3 to 4 omega-6s. You're still in the safe zone. Most people are one omega-3 to 20 or 30 omega-6 fatty acids. But it's not just a ratio. So if I eat a lot of omega-6s and eat a lot of omega-3s, I'm still getting a lot of omega-6s. We really need to reduce the omega-6 fatty acids. Those vegetable oils, the corn, the soy, got to cut those out, folks. The peanut. Those are the things that cause damage. Anything processed, unless it's really a healthy food, look at the label. Chances are it's going to have peanut oil, soybean oil, corn oil, vegetable oil, hydrogenated oil, which even makes it worse. So you got to look at what's going on in the body. And you got to look at the types of oils you're putting in there, because that is just weakening your immune system like crazy. Now, yes, you should take vitamin D. Absolutely. I take Dr. Joe's vitamin D every single day. I take 5 drops a day. The other day, I was really tired. I couldn't sleep one night. I just did a late night show, and I was wired. It was a good show. I was on fire. I got home, and I laid in bed. I couldn't sleep. So I woke up, had to go to work. I was tired. And so I got a little scratch in my throat. And I thought, uh-oh. Now, it could be because I just did a long show. It could be I talked too much. It could be I didn't drink enough water that day. So I doubled up on my vitamin D. I doubled up on my glutathione. Glutathione is another supplement I recommend for the immune system. I took a double dose of Super Greens and Essential Source, and I sucked on 2 zinc lozenges. Within hours, my throat was fine. So whatever it was, whether it was an infection or not, I have no idea. But whatever it was, I was fine.
Same thing happened to me yesterday.
Oh, what happened to you?
I went out of town for a funeral and came home feeling way overdone. My ears were ringing, started to hurt, which is usually a sign for me. Neck started to hurt. Came into work and kind of got like somewhat of a cold sweat almost, and started feeling bad. So I let everybody know, stay away from me. I did 50,000 IUs of vitamin D. I did another 25,000 this morning. I did 3 doses throughout the day of Essential Source. I took our immunobiotic, B12 or B complex, and then I did take one decongestant, and I feel great.
There you go. It was gone. Yeah.
Woke up like nothing happened.
Yeah, so what Garrett's saying, what I'm saying is, we're going to have moments. Now, whether Garrett was sick, whether I was sick, I don't know. But you want to be proactive when it comes to these things. I'm not saying I have a cure for COVID or cure for anything. I'm just saying what I do, what Garrett does, and how quickly you start to see results. In most cases, the quicker you get it, the better it is. Now, we're a team of chiropractic and medical professionals. So we are very good at neck pain, back pain, shoulder pain, headaches. Our medical profession is very good. Our medical doctor is very good at things like PRP. PRP is we take your platelets out of your blood, spin them down, and that's the growth factors, re-inject it back into your body. And those platelets can stimulate new growth. And so very good for arthritis, very good for pain management, torn muscles, bicep tendon, any type of tendon, trigger point therapy, but it's also good for things like erectile dysfunction. You can kind of generate new life, new cells. Hair growth, spotty hair growth, you can do a PRP injections. Women that have urine leakage, you can do it for that as well, tighten up the muscles in that area. So there's a lot of things that PRP can do, and chiropractic and digestive issues. every show I talk about digestive issues, and every day patients come to our office and say, Dr. Joe, you said something about adjusting the stomach, pulling it down away from the diaphragm so that I get rid of the acid reflux and the heartburn and the burping and the gas and the bloating. Yeah, we do it all day, every day, and the results usually are phenomenal. Nutrition, supplements. So we are truly a wellness center. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. So the quicker you get to see us, if you have a health issue, the better off you're going to be, just like Garrett and I just talked about. If you have a little symptom, there's a protocol to follow. And so if I have a little symptom, I know this is what I need to do. We have a laser now. Laser light can stimulate what's called mitochondrial growth. And the mitochondria are the part of the cells that help produce energy. So it can be used for pain. It can be used for sciatica, neuropathy. You can go right through the skull and stimulate brain mitochondrial function. So people with traumatic brain injuries, headaches, we're seeing amazing results. Old injuries, 20, 30, 40 years old. The laser can get in there and start to stimulate mitochondrial growth. So we do a lot of different things to help get patients well. And so the quicker you get to us, the easier it's going to be to deal with. So if you have a health issue, you can always go to our website, drjoe, drjoe.com. You can book an appointment right online. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. You can call us if you want to. The phone number's on the website. And we're more than happy to set up an appointment and talk to you and try to find out what it is that's causing the problem, not just treating the symptoms. Usually the first visit is $375. Garrett's convinced us to keep it at $199, and we're going to keep it at $199. That's an exam, x-rays, consultation, first adjustment, the second visit going over your x-rays, and doing a whole nutrition workup. Nutrition workup alone is $150. So if you want to make an appointment, please do it right away. We can't run that special forever, of course. And folks, if you come in for your first visit, understand you have to come back for your second visit. It's included. The going over the x-rays and the nutritional evaluation is included. You have to do that. Otherwise, you're totally wasting your time and your money. Don't even bother coming in, because you need to come in to see those x-rays and explain what it is. You're probably going to need further care from there. And we accept almost all insurances, car accidents, sports injuries. If you're ever in a car accident, if the car was damaged, you were damaged 100% of the time. I don't care. The insurance company says, oh, it was a minor injury, the car wasn't damaged. You were hurt. In my case, I've never seen it ever in 35, 40 years of seeing car accident cases. I've never seen somebody walk away from a car accident unhurt if the car was damaged. So you need to make an appointment right away. The quicker you get to us, the better you're going to be. So, and also when it comes to pain and injuries, we do try to get our patients off the omega-6 fatty acids or try to reduce it to a minimal because it causes inflammation. And of course, as your chiropractor, as your pain management doctor, as I'm a chiropractic orthopedist as well, I'm board certified in nutrition as well. As your doctor, my team of doctors want to get you well as quickly as possible. So it's not just chiropractic, it's not just medicine, it's not just nutrition, it's not just supplements, it's everything. And that's what we find works best. And if something worked better, I'd be doing it because I'm a patient too. Garrett's a patient. We want to get the best results as quickly as possible. So cutting back on your omega-6 fatty acids is going to be really important. And it's also now proving that it has a direct impact on people with COVID. Well, studies are showing. I can't say proving. Studies are showing. How about that? So back to that paper. Getting back to the paper, fat intake and how it affects your COVID outcome. The gastroenterology paper points out that unsaturated fats cause injury and organ failure resembling COVID-19. More specifically, unsaturated fats are known to trigger lipotoxic acute pancreatitis and sepsis and multiple system organ failure, just like it is seen in severe COVID-19 patients. So you're getting a similar reaction here. Now, let's play devil's advocate for a second. Let's assume I'm wrong. Let's assume that omega-6 fatty acids and hydrogenated oils have no effect whatsoever on COVID. So what? We know it has effect on other things. So my submission in this new world that we're living in is do everything you can to keep your immune system as healthy as possible. If you start doing things and cheating, you're really running a high risk. So whether it's COVID, cold, flu, cancer, heart disease, diabetes, obesity, brain function, Alzheimer's, Parkinson's disease, you still want to take care of your nervous system, you want to take care of your digestive system, and you want to take care of your diet. I can't imagine a day going by without me eating something raw at every meal. In fact, just before I went on the air, I had some snap peas. I can't imagine not taking supplements. I recommend you minimum take Dr. Joe's Super Greens, Dr. Joe's Essential Source, and Dr. Joe's Vitamin D. That's the minimum supplements you should be taking, especially in this world. I take omega-3 fatty acids, I take digestive enzymes, I take B-complex, I take adrenal support, I take male hormone support, I take estrogen regulator, Estrogen regulator helps prevent my testosterone from converting into estrogen. Male hormone support helps build my testosterone levels up. Because as you get older, testosterone levels drop. And every day, my practice, we have 4 practices, Marietta, Duluth, Stockbridge, and West Cobb. People come in, especially men, and say, Dr. Joe, I'm having trouble in the bedroom. That's average. It's not normal. It happens to all men. Your testosterone levels drop. It is what it is. But we can do things to keep those testosterone levels up, keep the immune system functioning as well as we can as well. And the same protocols apply. That's what's so cool about this. So ideally, cooking with oil is not a good idea. If you're going to cook with oil, use as little as possible. Deep frying foods, not a good idea. I have to say I've become a fan of, for a lot of folks, for air fryers. Because air fryers still create acrylamides when fats are heated, like potatoes and oil, but you're using much less oil, so you have much less damage. So instead of deep frying things, I'm hoping the world starts going more toward an air fry concept. It's not ideal. It's not perfect in any way, shape, or form, but it's a lot less damaging than deep frying foods. So the less oil you use, the better off you're going to be. And nuts and seeds, they have omega-6 fatty acids in them. You can use these, though, because they have natural antioxidants in them. They have fiber in them. So it's not as bad as the processed oil. Because oil, once it becomes an oil, is processed. Coconut oil is no longer coconut, it's coconut oil, olive oil. So use minimum amounts. Use organic oils. Use fresh oils. If they start going bad, throw them out. And nuts and seeds, some are better than others. The ones with the lowest amount of omega-6 fatty acids, chia seed, almond, flaxseed, pistachio, hazelnuts, cashews, and the winner of all of it, macadamia nuts. So if you like macadamia nuts, which I do, they're amazing. And macadamia nuts also have omega-6 fatty acids in them, just like walnuts. So if I had to pick one nut that's going to be the winner of all of them for the best health benefits, it would probably be walnuts would be number 1, macadamia nuts would be number 2. But once again, folks, if they taste a little rancid, if they taste a little bitter, throw them away. If you just bought them at a store, bring them back. Because oils will go bad, and now we know that the unsaturated fats can oxidize, omega-6 fatty acids, oxidize, weaken the immune system, affect the organ function. There's no upside to eating excessive amounts of omega-6 fatty acids, and you cannot balance it out by taking more omega-3s. So omega-3 and omega-6 should be about 1-to-1 ratio. I take omega-3 fatty acids every day. Helps my brain, helps my inflammation, helps pain management. So we have that on our website, drjoe.com. We also have Super Greens and Essential Source are also on the website. Now, if you want supplements, and I can't imagine not taking supplements, but again, it's always your call. I've learned 2 things in my life. Don't argue with women, don't argue with patients. Because I've never won an argument either way. But when I can show patients, this is what I suggest. And most patients, 99% of our patients say, Dr. Joe, I'm here to do whatever you tell me to do. You're the expert. So every now and then some patient thinks they know more than I do. And I'll say, okay, that's great. I support your decision 100%. Inevitably, they come back and say, Dr. Joe, you were right. Some people want to research things. Research it. Oh, yeah, I'm not lying to you because these are the things that I do. And if there was a better way to take care of my health, I would be doing it, especially in times like this where the immune system is everything. And you've got to keep that immune system strong. And why are some people dying and some not? Like we said in the beginning of this segment, some people it's genetics, but some things you have control over. You have control of bad food you put in your body: sugar, wheat, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. You have control of your nervous system. In most cases, if you have neck pain, back pain, shoulder pain, chiropractic is the number 1 treatment for back pain. Most effective, least expensive treatment for most back pain. Not all, but most. So folks, if you want to make an appointment, do it online, drjoe, drjoe.com, the website, drjoe.com. All the supplements are available online, or we can mail them to you or pick them up. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. drjoe.com. I'm Dr. Joe Esposito. Tell your friends about the show. We'll catch you next time.
Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.